We're going to do some trach care on Mrs. Smith. Before entering the patient's room, though, I would go ahead and check the patient's chart and gather my supplies. I'm going to need a trach care kit, a sterile suctioning kit, suction to hook up to the wall, some saline syringes. Also, make sure we should always have in the room, but make sure that I bring some extra trach inner cannulas. Maybe also I can bring a face mask because that's usually not stored in the room. And then also a resuscitation bag and a trach mask to oxygenate my patient. So I'm entering, knock knock. Hi, Mrs. Smith. My name is Kate. I'm from the respiratory care department here at the hospital. We're going to do some trach care on you today, okay? This should at least be done twice a day, and communicate that with the nursing staff. So the first part, what I'm going to do is go ahead and wash my hands, put on gloves, assess my patient, checking her SpO2, listening to her breath sounds. I'm going to check the cuff pressure to make sure it's between 20 and 30 centimeters of water. And then we're going to go ahead and do the sterile suctioning. I'll hook up on the wall the suctioning and open up my sterile suction kit. The first thing will be with the gloves. Insert my left hand first, and that will be my clean hand. My right hand will be my sterile hand. We're going to go ahead and hyper my patient. And while we're doing that, I will grab with my sterile hand the suction catheter. I will go ahead and put some lubrication on my right hand and hook up the catheter to the suction. Then we'll go ahead and suction out my patient. All right, Mrs. Smith, we're going to go ahead and suction, insert. Now I feel some resistance, pull back a little bit, occlude the thumb port, and suction. 15 seconds, it should take more than that. We'll go ahead and lay that there. All right, Mrs. Smith, now we can go ahead, I'll give you some oxygen. Meanwhile, I'm monitoring my patient all the while, making sure, she's maintaining levels, that she's breathing, that she's comfortable. So now I can go ahead and start cleaning the stoma site. So I'll go ahead and untie this here. I'm going to hold on to the flange and go ahead and take out the inner cannula. If it's a disposable one, go ahead and toss it. If not, in my cleaning and my trach care kit, we have some pipettes you can insert and clean. Over here, there's a couple basins. A little cleaner, you can clean the outside of it and go ahead and set it to dry on the gauze provided. Next thing I'm going to go ahead and do is take out the old gauze, toss that, and then I'm going to start cleaning the stoma site. I'm going to work my way inward and one swipe out, disposing of my Q-tip each time. Go ahead and getting a new saline infused Q-tip and swiping and cleaning. Clean all the way around the stoma site. I'm monitoring it to make sure there's no foul odor, signs of infection, inflammation, excessive drainage, pus. Okay, so now that that's clean, we're going to make sure it's nice and dry. We're going to set a new gauze or foam pad underneath. Make sure it's not all lumpy. And then we'll go ahead and tie a new trach collar around. We can insert either the trach that we cleaned or the inner cannula that we cleaned, or if it was disposable, we'll set a new one in there. Okay. I'm going to make sure I check that cuff pressure, and then we're going to make sure I reassess my patient, check her vitals, make sure she's breathing comfortably, set her in an upright position or whatever position is comfortable for her, and that she has her call light and she is comfortable. And that's it.